Hi, my name is Mohammed,
And my name's Dennis.
and today I'll be exploring the impacts of health informatics in the medical field and the lives of patients.
And I'll be exploring how the use of smartphones and technology are helping doctors better help their patients for the future.
Hi, my name is Mohammed, and I'd be asking Elizabeth a few questions about health informatics. So, how do you define health informatics, and how is it different from nursing informatics?
Thank you, Mohammed. So healthcare informatics is defined as the integration of healthcare sciences, computer sciences, information science, and cognitive science to assist in the management of healthcare information. Nursing informatics is a subset of informatics specific to the field and to the role of the nurse in the healthcare setting.
Thank you for answering that question. Would you mind answering another one for me? What are some clinical implications in how data is collected?
There is a gap between the technology side and the process. This can be merged using advanced monitoring equipment and technology.
How are managerial implications foreseen in the workplace?
Technology is used to improve communication among staff and patients, streamlining the process and making it more efficient.
So I got one last question for you. How has the technology boom at the turn of the century helped information systems and informatics evolve?
It enhances delivery care and improves health outcomes and improves patient education, although these are only a few of the many aspects that have been improved.
Thank you for your time, Liz. I really appreciate it.
My name is Dennis. I'm going to be interviewing Andy today. And so my first question I have for you today, Andy, is there's been a lot of discussion on the implications of smartphones and related devices on monitoring patient health and symptoms. What have you found in your findings?
Well, DJ, basically they found that for these patients, they were recording their symptoms like every day for 3 months, and then it was analyzed and put in a graph form so that when they went to their consultation, it could be more focused on the patients than, actually trying to remember what they were doing.
Very interesting take on that, Andy. I also have another question for you. What are some positives of using the digital remote monitoring that you've seen?
Researchers actually found that the app captured long-term trends that the patient could have forgotten, or actually allowed the doctor to focus on symptoms that the patient could have overlooked.
Pretty interesting. Do you mind explaining more on that? Give me some examples on how that can be seen.
Well, a lot of it is symptoms or chronic pain or inflammation or trouble sleeping that the patient would have a hard time remembering.
Cool, Andy. Well, thank you very much for your take. I appreciate everything that you had. All right, Kristen. So now I have some questions in regards to medical informatics, and can you please tell me more about it and why should we care about specifically?
My name is Kristen, and I will be talking about what we learned in lecture this week. So, what exactly is health informatics? It is a very new field. It consists of collecting as well as analyzing any health-related data that would be able to contribute to improving the healthcare system. In class, our professor incorporated a quick activity where we exchanged social medias with a complete stranger and tried to gather information simply based off their profiles. And what this activity did was truly show us how much information we can gather off of the data of one individual. So this can be extremely beneficial to the healthcare system because with the help of modernized technology, it would be able to increase the availability of knowledge that is needed to solve problems within the healthcare system. This would be able to result in less medical errors, lower medical costs, and it can also improve the clinical productivity. So with the continuous advancements in technology, the medical informatics field continues to grow and retrieve more and more data that can help optimize healthcare in this world.
Wow, DJ, we learned a lot this week.
You definitely did, Mohammed, and we'll see you next week.